Let me start with a simple question. Have you ever had stomach pain, bloating, gas, or sudden toilet runs? And when you finally went to the hospital, they said everything looks normal? But you know something isn't normal. That's what IBS looks like. Today, let's talk about Irritable Bowel Syndrome, also known as IBS. What it really is, why it happens, and what you can actually do about it. I advise you watch till the end, and this is packed with vital information that will change your health forever. What exactly is IBS? IBS is a functional digestive disorder. That simply means your gut looks normal on tests, but it doesn't function normally. There's no ulcer, no tumor, no infection. But the symptoms, very real. IBS mainly affects the large intestine and can cause abdominal pain, bloating, gas, diarrhea, constipation, or sometimes both diarrhea and constipation alternating. And here's something important. IBS is chronic. It can last for years. It may come and go, but it's manageable. IBS is more common than people think. Many people are walking around with IBS and don't even know it. It's especially common in young adults and tends to affect women more than men. And because it's not something you see on a scan, people sometimes dismiss it. But if you've lived with it, you know it can disrupt school, work, relationships, travel, even your confidence. The different types of IBS. Not all IBS looks the same. There are three main types. IBS-D, mostly diarrhea. IBS-C, mostly constipation. IBS-M, mixed, both diarrhea and constipation. Knowing your type matters because management can differ. What causes IBS? Now this is where it gets interesting. We don't have one single cause. IBS is usually a mix of factors. First, gut-brain connection. Your gut and brain talk to each other constantly. When you're stressed, anxious, or overwhelmed, your gut reacts. Ever had diarrhea before an exam? Butterflies before public speaking? That's the gut-brain connection. In people with IBS, that connection is more sensitive. The gut overreacts. Second, food triggers. Certain foods can worsen symptoms. Common ones include dairy, for those sensitive to lactose, beans and some vegetables, fried or fatty foods, caffeine, carbonated drinks. But here's the thing, triggers are personal. What affects one person may not affect another. Third, gut sensitivity. People with IBS tend to have a more sensitive digestive system. Normal gas levels that wouldn't bother someone else may cause real pain in someone with IBS. It's not in your head. Your gut nerves are just more reactive. Fourth, past infections. Some people develop IBS after a severe stomach infection. Even after the infection clears, the gut never fully resets. IBS versus something more serious. Now let's be clear, IBS does not cause cancer. It does not damage your intestines. It is not the same as inflammatory bowel disease. But, and this is important, if you notice, unexplained weight loss, blood in stool, persistent vomiting, severe nighttime symptoms, please see a doctor. Those are not typical IBS signs. The emotional side of IBS. This part doesn't get talked about enough. Living with unpredictable digestion can be exhausting. You may avoid events. You may constantly look for toilets. You may feel embarrassed. And the stress from that makes symptoms worse. It becomes a cycle. That's why managing IBS isn't just about food. It's about lifestyle and emotional health too. How is IBS diagnosed? There's no single test for IBS. Doctors usually diagnose it based on symptoms, how long they've been happening, and by ruling out other conditions. If symptoms have been present for at least 3 months and follow a certain pattern, it may be IBS. Can IBS be cured? Right now, there's no permanent cure, but it can absolutely be controlled. Many people live normal, full lives once they understand their triggers and manage them properly. Practical ways to manage IBS. Let's talk about solutions. First, know your triggers. Start noticing patterns. What did you eat before symptoms started? Were you stressed? Did you skip meals? A simple food and symptom journal can change everything. Second, eat slowly. Rushing meals causes you to swallow air and stresses your gut. Slow down, chew properly. Your stomach is not in a race. Third, watch fiber, but be smart. If you have constipation, fiber can help, but too much too fast can worsen bloating. Increase fiber intake gradually. Fourth, manage stress. This is huge. Practice deep breathing, walking, prayer, journaling, therapy if needed. When your mind is calmer, your gut often follows. Fifth, regular movement. Exercise improves bowel movement and reduces stress. It doesn't have to be intense. Even 20 to 30 minutes of walking helps. Sixth, hydration. Water supports digestion. Especially important if constipation is part of your IBS. What about probiotics? Some people benefit from probiotics. Some don't. It depends on your gut and the stain used. This is why professional guidance helps instead of randomly buying supplements. When to see a doctor. If symptoms are new, severe, or changing, don't self-diagnose. And if IBS is affecting your quality of life, speak up. There are medications and therapies that can help. You don't have to just manage it alone. The most important thing, IBS is real. It's not a weakness. It's not attention-seeking. It's not something you're imagining. Your gut is sensitive. That's all. And once you understand it, you gain control back. If you've been struggling with bloating, irregular stools, or unexplained stomach discomfort, don't ignore it. Listen to your body. And if this has helped you understand IBS better, share it with someone who may need it. Like and subscribe to Bolveek Health, because here we are connecting you to better health. I'll see you in the next video.